Okay, so blood clotting cascade. So cleavage of endothelial cell leads to exposure of glycoprotein tissue factor. Tissue factor binds to factor 7 to form TF7 dimer, which is a serine protease, which will cleave and activate factors 10 and factor 9. That's the extrinsic quick pathway. Intrinsic pathway, exposure to collagen and ECM from the cut due to the cut leads to activation of factor 12, which leads to activation of factor 11, which will lead to activation of factor 9 and stabilization of factor 9 and activation of more generation of factor 10. So also factor 10 will bind to factor 5 to form prothrombinase. Prothrombinase will activate thrombin. Prothrombinase will activate prothrombin, turn it into thrombin. Thrombin will go on to do many important things. First is it will turn fibrinogen into fibrin, and fibrin will ultimately create the covalent bonds to make the blood clot. Secondly, thrombin is going to recruit the platelets from the megacardiocytes to form the mesh structure of the blood clot. Thirdly, thrombin is going to activate factor 13, which will help form the covalent bonds of fibrin to form the blood clots. Fourthly, it will activate factor 8 as well as VMF factor to form the stabilized factor 9, so it could form more complex 10 to form more factor 10. It will additionally, fifthly, thrombin will stabilize factor 11, so it will stabilize factor 9, so they can make more factor 10. And lastly, thrombin is going to stabilize factor 5, so they can bind to factor 10 to form prothrombinase.